Welcome to Health Diagnosis. Today, we are going to talk about a problem that affects millions of people around the world but often goes ignored: a urinary tract infection, or UTI. It's a condition that can start with mild discomfort but, if left untreated, can lead to severe complications. So, let's understand what it really is, why it happens, and how you can treat and prevent it naturally and effectively. The urinary system includes the kidneys, ureters, bladder, and urethra. Its job is to remove waste and extra water from the body. When harmful bacteria, especially E. coli, enter this system, an infection begins. Most UTIs start in the bladder and urethra, but if the infection travels upward, it can reach the kidneys and become dangerous. In the beginning, symptoms are usually mild: a burning sensation while urinating, frequent urge to pass urine, pain in the lower abdomen, and cloudy or foul-smelling urine. Some people may even notice a little blood in their urine. In severe cases, the infection may cause fever, chills, nausea, and back pain, which means it might have reached the kidneys. Women are more likely to suffer from UTIs due to their anatomy, as the urethra is shorter, making it easier for bacteria to travel to the bladder. However, men are not safe either, especially those with prostate enlargement, diabetes, or those who don't maintain good hygiene. Ignoring the signs of UTI can be dangerous. The bacteria can spread and affect the kidneys, leading to a condition called pyelonephritis. That's why early detection and proper treatment are very important. So, what can you do if you feel like you have a urinary tract infection? The first step is to increase your water intake. Drinking plenty of water helps flush out bacteria from the urinary tract. Avoid holding urine for too long. Whenever you feel the urge, go. Holding urine gives bacteria time to grow. Next, pay attention to your hygiene. Always clean from front to back after using the toilet to prevent bacteria from spreading to the urinary area. Avoid using harsh soaps or sprays in that area, as they can irritate the urethra and increase infection risk. Cranberry juice is often recommended because it contains compounds that prevent bacteria from sticking to the urinary tract walls. However, it's important to choose natural, unsweetened cranberry juice. Sugar can make infections worse. Probiotics also help, especially those containing lactobacillus. These beneficial bacteria support the natural flora of the urinary tract and prevent harmful bacteria from growing. For people with recurring infections, dietary changes can make a huge difference. Reduce caffeine, alcohol, and spicy food, as these can irritate the bladder. Instead, eat more fruits and vegetables, particularly those rich in vitamin C, like oranges and amla, because vitamin C boosts immunity and acidifies the urine, making it harder for bacteria to survive. In the homeopathic approach, UTI treatment focuses on individual symptoms and underlying causes rather than just killing bacteria. Some of the most common remedies include cantharis, sarsaparilla, berberis vulgaris, and apis mellifica. Cantharis is used when there is intense burning and cutting pain during urination, with frequent urges and very little urine passed each time. Sarsaparilla is useful when the pain is felt mostly at the end of urination and when urine passes drop by drop. Berberis vulgaris helps when there is pain radiating from the kidney region to the bladder, and a feeling of soreness in the back. Apis mellifica is chosen when there is a stinging, burning pain with a desire to urinate frequently but only a small amount comes out. But remember, these medicines should be taken only after consulting a qualified homeopathic doctor who can match your specific symptoms to the right remedy and potency. In addition to homeopathic treatment, lifestyle management is key. Always wear loose, breathable cotton underwear to keep the area dry. Avoid sitting in wet clothes, and take showers instead of baths to reduce bacterial exposure. For women, urinating after sexual activity is one of the simplest and most effective ways to prevent infections. It helps flush out any bacteria that might have entered the urinary tract. If your infection keeps returning, it might be a sign of an underlying issue, such as kidney stones, diabetes, or hormonal imbalance that needs further evaluation. In such cases, a urine culture test is done to identify the exact bacteria causing infection, and treatment is adjusted accordingly. UTIs can also occur in children and older adults, often with different symptoms. In children, you might notice irritability, fever, or reluctance to pass urine. In elderly patients, the symptoms can be vague confusion, weakness, or sudden loss of appetite, so awareness among caregivers is extremely important. Untreated UTIs can lead to chronic kidney disease, which is a lifelong condition. Therefore, never ignore even mild symptoms like burning urination or lower abdominal discomfort. Early treatment means quicker recovery and less chance of complications. For people suffering from frequent infections, one natural preventive measure is maintaining a healthy immune system. Get enough sleep, manage stress, and include immune-boosting herbs like tulsi, neem, and garlic in your diet. These natural agents have antibacterial and anti-inflammatory properties that help protect your body. UTI prevention is about building habits, staying hydrated, maintaining hygiene, and avoiding irritants. It's not about one-time treatment, but long-term protection. So, if you or someone you know has UTI symptoms, don't feel embarrassed. It's a common issue and completely treatable. Early diagnosis, proper medication, and lifestyle care can save you from severe discomfort and complications. Remember, your health is in your hands. Don't ignore your body's signals. Drink water, stay clean, eat healthy, and if symptoms persist, consult a doctor immediately. This message is brought to you by Health Diagnosis, where we believe in spreading awareness, natural healing, and healthy living. Stay connected with us for more helpful information on how to protect your health and live better every day. Thank you for watching, take care, and see you in the next video.